Perhaps one of the most difficult topics for us as human beings to talk about is death. There are many reasons for this, as death is perhaps the only finality we know that exists in our lives. So let's face it, death is scary. The unknown aspect of it is perhaps what causes it to be such a great fear and a difficult topic in the first place. Recently, however, there has been a notion gaining traction that death is not something to be afraid of. Rather, it is something that we should have a choice in. The Death with Dignity movement, also known by many as assisted suicide, is attempting to take some of the pain out of death by allowing patients a choice in their own fates. Essentially, a patient with a terminal disease is given the choice to refuse end-of-life care and instead choose to end their life with the assistance of others. This can be done in a variety of ways, such as a hood that is filled with helium gas, a dose of Seconal or Nembutal, or a cocktail of lethal drugs that will be injected. But of course, it must be mentioned that legally, a terminal disease is defined as an incurable and irreversible condition caused by injury, disease, or illness that would cause death within a reasonable period of time in accordance with the accepted medical standards, and where the application of life-sustaining treatment would serve only to prolong the process of dying. That definition is very important. Assisted suicide, as you may have guessed, is a very controversial topic. There are many reasons for such a controversy, such as a worry that it violates the Hippocratic Oath for doctors, that people would choose it instead of other options such as hospice care, that it would lead to more of the elderly choosing it so as not to be a burden on their families, or that it would unfairly target those with disabilities. In fact, recently NPR found that a slim majority of Americans favor death with dignity, with 55% being for and 45% being opposed. An almost identical amount of American physicians favor it, with 54% being for and 46% being opposed. With the kind of controversy this topic has created, it should come as no surprise that only 5 states allow it: Oregon, Washington, New Hampshire, Vermont, and most recently, California. Of those 5, Oregon has had legislation for it the longest, since 1994. Other countries with laws legalizing physician-assisted suicide include Belgium, the Netherlands, and Colombia. And while these concerns are all very real and important, death with dignity is all about making sure the patient's wishes are heard, and there are many safeguards in place to prevent it from being abused. For example, even in areas where it is legal, only a small amount of people actually receive assisted suicide. One must be terminally ill, and even then they may be denied depending on the doctor. A New England Journal of Medicine study found that doctors accepted only 1 out of every 6 requests for assisted suicide. Before we move on, we should take some time to compare 2 different laws regarding assisted suicide in 2 different places, Oregon and Belgium. In Oregon, the law, which was passed in 1994, states that a legal adult can request end-of-life services from a physician if they are in a sound mind and diagnosed with a terminal illness that has been confirmed by 2 doctors and have only 6 months to live. In Belgium, which passed its law in 2002, a person must be of a sound mind and have a terminal illness certified by 2 doctors, much like in Oregon. However, there is no time limit on the terminal illness, and recently the law has been extended to terminally ill children. Another very important difference between the 2 laws is that in Oregon, a terminally ill person must administer the life-ending drugs themselves, where in Belgium, the patient can request a physician to administer the drugs, which is commonly referred to as euthanasia. In Oregon, since the law's passage in 1994, 754 people have taken their lives using it, which is an average of 38 per year. In Belgium, the number is much higher, with around 1,400 people using the law to take their lives per year, including a record number of 1,807 in 2013. In both countries, statistics show that the amount of patients requesting assisted suicide is on the rise. Let's take some time to look at 2 fictional but very possible cases of what could happen when a person requests assisted suicide. The first involves an elderly couple, both of 68, named Bob and Cindy Lankum. Cindy has recently been diagnosed with Alzheimer's, a disease which will rob her of both her mobility and memories. Cindy does not want this. She does not want to live to see the day she will forget her beloved husband or her 3 children and 7 energetic grandkids. What Cindy wants is a choice. She wants the option to choose to die with dignity on her own terms. But the problem is that she lives in Michigan, a state that has outlawed assisted suicide. So she begins to do some research and becomes interested in the idea of moving to Oregon so that at some point, if her Alzheimer's progresses to an unbearable level, she can end it by her own choosing. She must spend 12 consecutive months in Oregon before she is a resident, and then she can apply to go through with assisted suicide. One must remember, though, she has to have a doctor certify that her terminal illness has progressed to a point where she would only have around 6 months to live. She can then purchase a drug like Seconal, which, when the 100 milligram dose is mixed with water, will put her into a coma, and then a few minutes later she will pass on. Of course, she can also choose another drug like Nembutal, which comes in a convenient liquid form, but with it often costing $1,000 for a lethal dose, it is likely she will choose the much cheaper Seconal. She can purchase the drugs when her physician okays it, but it will be her choice when or even if she takes them, as according to an article on Vox, Oregon doctors have learned that about 1/3 of people who purchase the drugs for an assisted suicide never end up taking them. If perhaps she worries that waiting for her disease to progress to those final 6 months will be too painful, she could always try Belgium, which has no requirement for residency, and where, though the disease must still be considered terminal, there is no 6-month limit. It is likely that Linda will choose Oregon, though. She likes the thought of dying in her own country, and has also fallen in love with the beauty of Oregon's landscape. While Linda's case, like every case, is sad in many ways, we can perhaps take some comfort in the fact that she will have some control over her fate. Another, much more controversial example would be this one. An active 26-year-old named Derek Rodriguez has been in an unfortunate snowboarding accident that caused him severe head trauma and damage to his spine. Not only is he paralyzed, but he is barely able to talk and is dependent on a feeding tube. It has been a very emotional time for Derek and his family, especially because Derek has made it clear that he does not want to go on living. Though they are understandably sad, his family is also very supportive of his decision. But when Derek and his family try to push for death with dignity, they run into a problem. Even though he is paralyzed and fed through a tube, Derek cannot seek assisted suicide because he is not terminally ill. Even in the country with the most progressive laws on death with dignity, Belgium, Derek is unable to qualify for assisted suicide. His condition does not qualify as terminal, as, remember, terminal is defined as an incurable and irreversible condition caused by injury, disease, or illness that would cause death within a reasonable period of time in accordance with accepted medical standards and where the application of life-sustaining treatment would serve only to prolong the process of dying. So, though he is paralyzed, he could end up living many more years on a feeding tube. Even if he wants to die, he currently has no legal right to do so. The reason why we're using a story like Derek's is because it demonstrates that there are still many questions surrounding assisted suicide, especially regarding how we define terminal disease. Can it be extended to include things such as accidents resulting in paralysis and mental issues such as depression? Death with dignity is a very difficult topic because there is probably no true right or wrong answer, and everything must be looked at on a case-to-case basis. But whether you believe it is a civil right or that it goes too far, it is important to be educated about it. There are plenty of sites out there which explore many more aspects about this topic, including the pros and cons. Here are a few we recommend that you check out.